My name is Marissa Schwades, and my presentation is about generalized anxiety disorder and the treatments available. At some point, we have all felt anxious or worried about something that has occurred in our life. The purpose of this presentation is to distinguish how generalized anxiety disorder is different from anxious moments everyday people experience and the treatments that are available to help cope with this disorder, as they are not widely utilized by people suffering from this illness. Although the exact cause is unknown, many people believe that biological factors, family background, and life experiences all play a role in the onset of the disease. GAD can begin at any point in the life cycle, although the risk is highest during childhood and middle age. Although it is not widely discussed, the Anxiety and Depression Association of America states that GAD affects 6.8 million adults, or 3.1% of the population each year. Women are twice as likely than men to suffer from GAD. GAD can exist on its own, but it is typically co diagnosed with major depression. Nearly one half of those diagnosed with depression are also diagnosed with an anxiety disorder. GAD is officially diagnosed when a person finds it difficult to control worry on more days than not for at least 6 months and has three or more of the following symptoms: restlessness, fatigue, irritability, difficulty concentrating, muscle tension, and trouble sleeping. Although the following physical symptoms are not directly used to diagnose GAD, they are usually present when GAD is diagnosed: excessive sweating, nausea, diarrhea, easily startled, shortness of breath, racing heart, and shakiness. Some characteristics that can be used to identify the onset of GAD include if a person feels anxious or worries all of the time, thinks the worst about everything, feels their anxiety is greater than stress and makes them feel powerless, tries to plan or control situations, and if the intensity of their worrying is excessive for the current situation. Because people with GAD believe worrying prevents bad things from happening, they view that as risky to give up worrying all the time. Additionally, they may avoid situations because they have the disorder, or they may not take advantage of opportunities due to their worry. Some of these opportunities include social situations, travel, and promotions. In turn, this can cause impairment in their relationships, work performance, and general functioning during their daily lives. Furthermore, those who suffer from GAD are afraid of losing control, failing, rejection, abandonment, and death or disease. As reported by Dr. Laura Ramos and her colleagues, most patients who have GAD have been ill for an average of 15 years before seeking help. However, there are a variety of treatments available. There are two mainstream treatments that are commonly used to treat GAD, known as psychotherapy and medications. There are also certain mindful behaviors that people recommend to ease anxiety as it comes on. All people with generalized anxiety disorder respond differently to each of these treatments. However, many say treatment is most effective with a mix of psychotherapy and medications. Psychotherapy is also known as short term talk therapy with a therapist. The most commonly used and most effective form of talk therapy for GAD patients has been cognitive behavioral therapy. This type of therapy helps the patient recognize and understand their thoughts and allows them to gradually return to activities they previously stopped doing because of their anxiety. It also teaches coping skills and mechanisms to enable them to ease their anxiety in the future. As discovered by Dr. Laura Mandos and her colleagues, between 50% and 60% of patients respond clinically to therapy, but only one third to one half attain remission or realize full recovery during the acute phase of treatment. Medications have proven successful for a number of patients suffering with GAD. However, there are some risks and possible side effects associated with some of the medications, which is why it's not always the top choice for some people suffering with GAD. The three types of medications include antidepressants, anti anxiety drugs, and sedatives. Antidepressants are taken for an ongoing basis, and 73% of users achieve moderate to marked improvement after steadily taking them, according to Dr. Laura Manzos and her colleagues. Some brands of antidepressants include Lexapro, Cymbalta, and Paxil. Anti anxiety medications are also taken for an ongoing basis. Some of these medications include buspirone. As a last resort, sedatives are sometimes used if the anxiety is extreme. In this case, it gives relief of anxiety symptoms during an acute attack, making it a short term drug. Some of these medications include benzodiazepines, but it is important to limit the use of them as they can be addictive. In addition to the two main treatments of generalized anxiety disorder, there are a variety of mindful behaviors that have been proven to ease the symptoms of anxiety and promote a healthier lifestyle overall. Some of these behaviors include daily exercise, limiting or stopping the use of caffeine, eating a healthy, well balanced diet, and yoga and meditation. According to the Anxiety and Depression Association of America, generalized anxiety disorder can be treatable, yet only 43.2% of those suffering receive treatment. Generalized anxiety disorder is a serious chronic disease that can affect a person's daily life and should be taken serious. While there is a lack of knowledge on the resources available or the stigma surrounding mental illnesses, it is important to know that there are many ways to seek help. The purpose of this presentation was to inform the viewer on the different treatments available and increase awareness of generalized anxiety disorder itself.